Hello everyone, and welcome to our Legalize marijuana policy paper presentation. My name is Miranda McFarlane, and I am the president of the SFU chapter of Young Liberals of Canada in BC. The resolution to legalize marijuana was originally put forth by the Young Liberals in 2008. And while it passed in BC, it failed to pass in Ottawa at the time. When we revisited the idea last year in 2012, however, it passed with great success. The Young Liberals of Canada have been known for suggesting contentious yet necessary policies which we feel are vital to our society, such as same-sex marriage, which became law nationwide in 2005, and our new policy that focuses upon increasing the safety of sex trade workers, which we passed at our policy conference last weekend and hope to fight for next. YLC-BC has worked hard to have our policy of legalization of cannabis made into reality. We were the only political party at the Vancouver Art Gallery on 4/20 and wish to emphasize the negative impacts of keeping this drug illegal. This policy has been debated in Ottawa heavily, both for and against the cause. At the last convention, about 80% of Liberals voted in favor of this policy resolution. Since then, we have been pushing for legalization nationwide, especially in universities. So let me start by introducing our panel here. In the middle, we have Sangeeta Lally. To her left is Michael Davis, and to her right is Mark Elias. Michael Davis will be introducing the policy, and Mark Elias is president of the Liberal of East Van. Thank you. And now I'll hand over the mic to Sangeeta.
Thanks, Miranda. Wow, this is loud. All right, well, a little over a year ago, in January 2012, sorry, let me just get my computer fixed here. It's not moving. Technology, eh? There we go. All right. Well, I'll start all over again. A little over a year ago, in January 2012, delegates at the Liberal Party of Canada's biennial convention in Ottawa voted in favor of a policy resolution which was co-sponsored by the Liberal Party of Canada in BC and the Young Liberals of Canada. This resolution had many great points in it, some of the biggest being that we wanted to legalize marijuana and ensure the regulation and taxation of its production, distribution, and use, while enacting strict penalties for illegal trafficking, illegal import, export, and impaired driving. We wanted to invest significant resources in prevention and education programs, especially for youth. Extend amnesty to all Canadians previously convicted of simple and minimal marijuana possession, and work with provinces and local governments of Canada on a coordinated regulatory approach to marijuana. Now, during the convention, like Miranda said, we did gain quite a bit of support. Mark and I, as well as Russ, who is somewhere in the river, there he is, we were working quite heavily during the convention on the floor, making sure that people knew about the policy. Russ and I were actually standing beside each other, and were surprised to see the number when it came out. I personally thought it was going to be around the 60s, but it was almost 80% of the delegates who were in favor, and we had about 3,000 in attendance during this conference. Now, not only did the Liberals support this, but so did the media. And I'm not sure if Ian is in here today, but we have his quote right there. Since the resolution was approved, a growing number of Canadians and community leaders have joined the call to the end of marijuana prohibition in Canada. the LPCBC Standing Policy Committee, which was formed just a little bit after the resolution was approved, has been working on this paper that we're presenting today, as well as this presentation, and this was along with the Young Liberals of Canada. The goal was to provide some answers to legitimate questions Canadians have about the impact of implementing this policy. Some of the answers are very short and just take one word, while others were very complex and require a lot more dialogue over the next coming months and even years. And in total, we have 36 questions, and these 36 questions are identified into 5 different categories. By working through those questions and through many discussions and a lot of research, a framework for legalization has emerged, and we are presenting that to all of you today. Over this last weekend, we also presented it to the Liberal Party of Canada members in BC during our conference, as well as to the leadership candidates who will be vying for the leadership position within the party and hopefully become the next Prime Minister of Canada. And with that, I will pass it off to Michael.
Okay, so how's the volume? Okay. So there's 5 major categories of questions, and we'll look at them in a bit of detail. The first area was policy, and the Standing Committee identified 10 commonly asked questions around the legalization of marijuana. Why do we want to legalize is the biggest one. Would a system of partial legalization, like decriminalization, be better? Who will be responsible for taxation, regulation? Should it be part of a federal-provincial agreement? What would the legal age be for consumption? Will people be allowed to consume in public or around children? Should legalization extend to other drugs? Would people consuming marijuana for medical purposes continue to be in a special category? What will the total impact be economically? And how will we guarantee that there won't be a black market for marijuana? So we'll just look at some of the answers that come out of that. The 5 reasons Canada should legalize and regulate marijuana, by far the biggest one is to fight organized crime. Take the profit motive out of it for organized crime. Use the new revenue to support important government services. And number 3, there's a big one. The current law doesn't work. There's uncontrolled access for youth, which is often first contact with organized crime. There's no product safety. I don't know if you all remember a few years ago when pot was being sprayed with some sort of weird pesticide. It was very dangerous. People were dying from it. Criminal records for thousands of average Canadians, and a significant burden on government budgets to enforce and prosecute. We also want to move towards evidence-based policy instead of just taking a political stance. And the current law is just not achieving its goal, which is to prevent use, particularly amongst youth. So we don't expect this to end organized crime, but it should put a few criminals out of business. Big question for many, should the legalization extend to other drugs? And we have a very strong answer to that, which is no. Regarding medical use, there will be no need for a medical marijuana program, which will also save taxpayers money. It also frees up doctors and researchers to do more research on the effects of smoking and alternatives to smoking. They're so constrained right now by the legal issues around marijuana. Economic impact of legalizing marijuana in Canada would be extremely positive, both for the government and for taxpayers. Washington State expects to generate about $2 billion over 5 years. That's just Washington State, and that's just the government revenue side. They're talking about 360,000 consumers. So if we project that out from Washington State's projections, you're looking at about $4 billion a year in Canada in annual taxation revenue.
You can shrink your slide.
I can't without moving that forward a bit.
4 billion.
It's 4 billion, yeah. We might mention it again. We like that figure. And then there's thousands of direct and indirect employment opportunities that come along with it. That's the other economic benefit. You start thinking about the agriculture, energy supply. You start thinking about the retail stores. There's transportation. There's packaging. There's manufacturing, there's inspectors, there's quality control, there's licensing officers, there's legal, gotta have lawyers, insurance, public relations, marketing, there's alternative products. I mean, there's a huge range of economic activity that would go on around this. The second major group of questions was around the international response, and the working group identified 4 common questions in this area. Can we legalize under international law? How can we do this with the United States so opposed? That's shifting a little bit, but still relevant. How will we control cross-border trafficking? Is the illicit marijuana trade in Canada connected to the violent cartels in Mexico, Central and South America? And what are those countries doing about it? Some of the answers that the working committee has looked at. Canada is party to these 3 international drug conventions. However, Canada is a sovereign country. We're free to make our own laws through the House of Commons. We have the right to withdraw from UN conventions, and other UN countries have improved their marijuana laws without sanction. Obviously, public opinion is changing in the United States, and it appears to be changing in favor of legalization. Regarding how the marijuana trade is connected to the violent cartels, there's numerous public police reports that connect Canada's marijuana industry to the international drug and weapons smuggling cartels, including the violent cartels in Mexico, Central America, and South America. Legal. They identified 8 commonly asked questions about the legal issues. Specifically, what laws would need to be changed? What are the courts said about the current laws? Are the current laws being enforced, and how many resources is that taking? And would those costs associated with that enforcement, would they be eliminated, reduced, how much? Will people be allowed to grow it in their homes if we legalize it? And should there be limits on the amount one person can possess and or purchase at one time? And what would the penalties be for people who operate outside of that new legal system? How will we enforce impaired driving laws? Will they need to change? And what will happen to the criminal records of people who have been charged and or jailed for marijuana-related offenses? And some of the answers. To legalize, we would need to repeal Schedule 2 of the Controlled Drugs and Substances Act. We would need to create a taxation and a regulatory structure with the provinces and with other stakeholders. And we would need to establish penalties for operating outside of that legal system. We strongly believe that legalization should be achieved through the political process as opposed to being imposed through the courts. And certainly the current law is not being enforced equally across Canada. There are some lessons that we can learn from court rulings around medical use of marijuana. It's been very tough to legalize possession without provisions for supply and personal growing. That's been a reoccurring issue as this has gone along. And we need to allow for non-smokable uses and derivatives. I was asked some very interesting questions about what is a derivative. Anyways, we'll talk about that later. Government should not overly limit the supply options, was the consensus going up with this. On the question of what limits to place on amounts for possession and or purchase, Washington State is going to allow residents over 21 to possess 1 ounce of marijuana at a time. This paper is recommending a 4-ounce limit. That would be for non-licensed vendors or distributors. That would be the limit that they could purchase or possess without a special permit. Right? This is kind of like buying a 60-ounce bottle of spirits instead of going there every week. The fourth category of questions was public health. The working group identified 4 common questions in the public health. How many Canadians currently use marijuana, and how much do they use? How many of them are under 18 years of age? What are the health implications of chronic, moderate, or occasional consumption? And what are the public health impacts of legalizing it or not? Would legalization increase the number of consumers? and some of the answers. Figures estimate that Canada's consumption rate is one of the highest at 17% of the 15 to 64 population. About 2 million Canadians over the age of 15 use cannabis at least once a month, about 3.4 million ounces a year. Monthly users consume on average 2.5 cigarettes, or 1 gram each day. Never heard them referred to as cigarettes before. Thank you. Health Canada reports conclude that 8.2% of young Canadians used cannabis on a daily basis. This one I think is huge. More than half of adolescent drug users can access marijuana and other legal drugs within 10 minutes. And doctors are already prescribing marijuana to more than 20,000 patients, treating a broad range of conditions: Alzheimer's, seizures, glaucoma, MS, OCD, HIV and AIDS. It's really quite astonishing. This is from the Lancet, peer-reviewed, and it compares the harm of 20 drugs using the scale from 0 to 3, with 3 being the highest. And this is more than just measuring the addictiveness, it's also measuring the harm from that addiction. Right? Very interesting to me that lower than tobacco, lower than alcohol, one of the lowest of the commonly used. And maintaining the prohibition essentially just protects the status quo for organized crime and pretty much guarantees uncontrolled access for you. Final category in the questions was logistics, and not surprisingly, there's a lot of questions in how this would be implemented and what the challenges and opportunities are associated with the legalization of marijuana. Would the legal system resemble the way that we buy and sell alcohol and tobacco? Which federal and provincial agencies would need to be involved? How will legalization impact current consumers and producers? How much will it cost? In the sense of how much will the product cost? Where will people purchase it, and how will it be packaged? How will it be taxed? How will the revenue be reallocated? And what terms and conditions would be applicable to the producers and distributors? How much would Canadian producers need to grow? And should we limit the market to just Canadian companies and domestic suppliers? Who would grow it? And will companies and individuals be able to put commercial protections on certain strains and brands? What will be the potency? Some of the answers that came out of the working group: alcohol production, distribution, and sales provides probably the best model, the most obvious model for Canada's legal marijuana framework. It would need to draw some elements from the tobacco system, things like packaging, labeling, youth strategy, that sort of thing. Consultation is obviously required with the provinces, with retailers, with producers, consumers, and the municipalities. How much will it cost? Washington's retail price estimate, $12 per gram. Average price in Canada for bulk gram is $6.50, with a single unit price, that would be a cigarette, $10 to $15 per gram. The bulk purchase is encouraged in the black market. The more you buy, the cheaper it is. So the paper is recommending a price of legal marijuana that would be 30 to 35% below the black market price. This would pretty much ensure that there's no profit margin left in it for the black market. Regarding how people will purchase and packaging, Washington is going to require a purchase through a Liquor Control Board licensee. So there would be a $250 application. There would be a $1,000 insurance and renewal fee for each licensee. And Washington State expects 320 retail outlets for 1,100 consumers per location. So if we extrapolate that out, at the same rate, Canadian businesses and nonprofit organizations would need to staff about 2,700 retail outlets across the country. Washington State is projecting annual revenues of over $565 million by 2015. This is the tax side of it, based on a 25% excise tax, and then there's state business and occupation taxes that also apply. This paper is recommending a 30 to 35% preferred tax rate for legalized marijuana in Canada. That would include the sales tax. And based on Washington State projections, again, similar consumption price trends, government revenue in Canada, as we had mentioned before, would exceed $4 billion a year. So it's a nice chunk of change this year. And the new revenue, really feel that that should be reinvested to strengthen the public health care system with an emphasis on mental health, addiction treatment, community youth partnerships. We feel that the market should be limited to domestic suppliers. This is out of respect for countries that don't have this type of policies. There's some issues that have to be taken into consideration there. Private sector and local nonprofit societies would be the producers, distributors, and retailers of the product. And this is just one of those random facts at the end that the average THC level in Canadian marijuana is 11.1%. So I'll throw it back to you to do the conclusions.
All right, for all of these questions, as we work through potential answers, we start to see the way forward. I want to share with all of you a summary of the conclusions and some of the recommendations of the policy working group. And after that, we will open up the discussion and start a bit of a discourse on this paper and try to figure out how we can make this paper better and how we can end up making this a policy one day. One of the things that we want everybody to take out of this paper is that while prohibition will require partnership with provincial and municipal governments, the federal government must take the first step in introducing legislation in the House of Commons that would be led by federal ministers of justice and health and a special cabinet committee, on organized crime, responsive to feedback from provinces and provide administrative flexibility. Be overseen by an interim authority to implement and consult with stakeholders, and be subject to review by the House of Commons Standing Committee. Secondly, decriminalization of small amounts of marijuana is a compromise that will please no one. It would result in a system where it is legal to possess, but not to sell or purchase. Law enforcement agencies would continue to remain in limbo if we were to decriminalize instead of fully legalize. Thirdly, regulating cannabis will have positive impacts on public health. The other positive benefits would include more difficult access for youth, quality production and regulatory standards, strict labeling provisions to better protect the health of consumers and producers, new revenue for public health services, and more research into health impacts. Profits for organized crime would be reduced. There would be less stress and stigma for 3 million consumers and increased access for medical consumers. And police resources can be redirected towards violent crimes and more harmful drugs. This will also generate billions of dollars for each year for Canadian governments. And we all know that that would definitely benefit all of us as citizens. Based on answers provided in this paper, common themes and elements of a new legal framework begin to emerge. Some of the elements the working group felt should be included in the legal framework are that the minimum age should be the same as alcohol for each province. There should be a revenue sharing template with provinces based on models established for alcohol and tobacco. There should be significant direct investments for a broad range of youth health promotion initiatives and an ability for provinces and municipal governments to place reasonable restrictions on where people can consume and purchase cannabis. There should be comprehensive packaging, labeling, promotion, price, quality, and marketing regulations based on tobacco regulatory framework, and to allow individuals to grow a limited number of marijuana plants for personal use. Also, to establish zero tolerance for import and export, increase criminal penalties for unregulated suppliers, reallocate police and law enforcement resources, commitment to reallocate some new revenues to study effects of cannabis use, intoxication levels, and law enforcement training, tougher penalties for impaired driving, and a limitation on the amount of marijuana a non-licensed vendor or distributor can purchase or possess without obtaining a special permit. The last few points for the legal framework include limiting of point of purchase to specialty stores and anywhere regulated liquor sales take place, enabling an open marketplace for a wide range of Canadian businesses, flexibility for a variety of packaging options and variants on THC rates, and a process to clear records for Canadians with prior convictions for marijuana possession.
Okay, so that is it. A lot of information there, and a lot of work went into it from the standing committee. At this point, we'd like to open it up. We'd like to ask for questions. What we're really looking for is anything that you think has been missed or anything that you think still needs to be answered to add value to this paper as it goes forward, right? We'll start with you.
Yeah, my question is, if the regulatory system can't stop the tobacco industry from putting carcinogens into tobacco just, so people will smoke more tobacco, why should we believe that the government legislating some sort of regulatory system on cannabis will keep us safe from the corporations doing the exact same thing?
Good point.
Well, I can't really answer that question at this moment, but I do see that I've heard of this concern. Cannabis is illegal, it's prohibited, so that we, as a nation, we don't have experience on production. The producers have gone underground, they're all criminals according to the law. So it's kind of a question that we may have to deal with in the future. The point behind this policy is to end the prohibition of cannabis because the war on drugs is a failure. So that's why we're doing it. But this is something that we will discuss.
That being said, that's a really good question, and I have written it down, and I will bring that up.
And I would go back to the point that at the moment it's completely unregulated. Like, we're getting pesticides and who knows what else in the product now. So I think there might be a matter of degrees.
People know people and trust people, so.
Yeah, but just to let you know, there
there
are big criminal organizations who are also involved in the cannabis trade,
absolutely.
and they don't care. They're spraying their plants with illegal pesticides that are completely illegal in Canada, yet they're using them on cannabis, and there are a lot of consumers. And one of the pesticides, I believe, is called Abbott. It's very cancerous. So these are things. This is an unregulated market, right?
I'm going to go to the gentleman in the maroon shirt at the back.
Thanks, sorry. And I'm Steve Finley, Secretary Treasurer of Law Enforcement Against Prohibition Canada. And I would argue with respect to that, as one of our speakers says, Peter Christ, your only choice with respect to cannabis or any illegal drug is who's going to run it. The choice of no cannabis doesn't exist in reality. It's 3 million people are using it. It is always going to exist. Your only choice is who's going to run it. And yes, the government has its defects. And yes, big corporations, we all know, have their defects. But call me crazy, is what Peter says. I'd rather have the government or the corporations with their defects running it than the Hells Angels. I really would. And one point about tobacco. It is true that there's some nasty stuff in tobacco. However, take note that because we regulate it, we've been able to reduce the incidence of tobacco use by 50% in the past 20 years.
Yeah, by demonizing the users, but
well, we've done different things, but
you
see, that is not even possible given no regulation. That's not even possible under prohibition. Under prohibition, you at least have the argument. You can at least start to influence the government as to what do we want, which way do we want to do this. Under legalization, under prohibition, you can't even have the discussion. You can't.
Yeah.
I just felt
The
that
gentleman
shouldn't be forgotten in this discussion.
The gentleman in the red shirt.
Thank you. First of all, I really wanted to thank you guys for doing this work. You started it a while ago, obviously before Washington and Colorado, so you look brilliant now because back then it wasn't nearly as much of a sort of
It's
it's great to see a major party involved in something like this finally. So thank you. As far as the tobacco thing goes, I mean, that's a bigger issue. But in terms of selling it, let's not talk about regulating it like tobacco. Talk about what they did in Colorado. Regulate cannabis like alcohol. Because people can relate to that. First of all, you use them both the same way. Right? You use alcohol and cannabis to bring another form of consciousness about. So regulating them together, and alcohol in the end has a better purpose than tobacco does. So I would say get rid of the references to tobacco. You can compare it to the alcohol industry. You just don't need that. So that's my feedback to you. You take it for as you like.
Question that I hear a lot, in particularly a lot of the ethnic communities around Vancouver that have a lot of cultural opposition, like especially the evangelical Chinese community where I grew up in Richmond, and that's about protecting youth from overuse or use at all of the drug. And so I was wondering what age was contemplated in these recommendations to cap it off, and what sort of regime was then contemplated for if someone is caught, quote unquote, using the substance at say age 14 or age 13. What then happens to them? Because it seems like if we believe prohibition's been a complete failure for everyone, then we also don't want to maintain a lot of the harsher penalties for people under that age as well, despite the risks that we know about of younger people using it.
I can answer that question. The first part of your question regarding what age limitations, we've recommended that it's based on the drinking age of each province. So obviously we're asking the provinces to regulate the age. As per penalties, I did not see it on.
There's nothing for penalties against youth, but yeah, great question.
Okay, so I recommend we just look at that.
I would probably, publicly recommend to my colleagues here that we keep it again under provincial regulation, because I think the provinces have fines for underage drinking. Maybe the fines should be the same as underage smoking.
Also, we are looking into adding a whole section on just youth. I think that's an important thing to do because that is a big issue.
This gentleman at the back in the gray.
My name is Neil Magnuson, and I had the opportunity to critique this document a couple of weeks ago. I said not any of my recommendations had been included in it, but I know it's been a long process, and I appreciate the opportunity tonight to be able to once again put that input in. I have several different things that I would critique. I'm not going to do it all at once because it'll be an ongoing conversation, I hope. First off, I'm really happy to be able to critique a document like this from the Liberal Party of Canada. That's amazing. I didn't think I'd see that this soon in my lifetime. It's very progressive of you. Of the things that you missed, which is what you asked for in this particular round of questions, you missed in the whereases. In the first couple of pages, there's 4 whereases there. One of the whereases needs to be that these laws bring the entire justice system of Canada into disrepute.
Totally.
And you cannot have, that's an untenable situation. You can't have that. With millions of people breaking the law daily here, this needs to be addressed. And that leads me to another point where there's several points within the document where it probably should have been included that these laws bring disrespect to the police and to the laws within our community.
Yeah.
And that should be referenced in there as well. I'd also like to say that you should probably edit it and take out the word marijuana wherever you're using it, not in the quotes that are there, and replace it with the word cannabis. Marijuana is a word that's been inflammatory and been used to demonize the plant over the years. So, and I'll have some other comments later on.
Totally agree with your comment. I just want to make a comment. I came through this process quite late, and I was kind of embarrassed because I presented the same paper at the convention on the weekend. It was an embarrassment of kudos. Like I had at least 10 people come up to me and say, "Brilliant, wonderful," and I'm like, "Oh, I just did the presentation." So I think that the reason I bring it up is that I think that there is a huge amount of. I think this may be one of those ones that comes out at the right time and has the right politics and the right practicalities, and it just might go somewhere. So very encouraging. The gentleman beside the projector.
I apologize for this. I'm sorry, Don Gordon. I'm a sociologist at Vancouver Center, and Henry's writing. My name's Don Gordon. And just a quick point here. I'm not exactly pro the policy for a variety of reasons. I realize the party's adopted it. That's fine. I'm wondering, the research on the actual, how this plays in the workplace, and stigma, into workers and how workers will be treated by large and small employers, TELUS, Bell, Telephone, whatever, in terms of disciplinary contexts. As sociologists, I'm just interested in sociology work, OBIR, Organizational Behavior, Industrial Relations. How is this going to play in the union movement? How is this going to play in terms of behavioral discipline inside the corporate and any kind of workplace, from small corner store, Max Milk stores, all the way up to large corporations like the Royal Bank? I mean, if my teller's high, am I going to want her or my bank manager or my bank vice president accessing my stuff?
You can't show up to work drunk, so I don't think you'll be able to show up to work high.
Yeah, the prohibition of cannabis has put a stigma.
But it is like a cigarette, forgive me. I mean, it's not exactly like a bottle, and our culture has not moved forward to identify it as a difference between a cigarette and a bottle of whiskey, for example. So,
well, you certainly have some issues around testing, right? Because
that's
the length that it's...
trains, planes, pilots.
I'm going to go to
Can I
oh, sorry, the response, and then the lady at the back.
I can respond to that as well. The prohibition of cannabis has put a stigma in society for the users, okay? You remove the prohibition, it's legalized, that stigma automatically goes away. The issue here that you're raising is, how do I know that the bank teller is not intoxicated? You know, companies do have rules and regulations. I own a business myself. I don't expect people to show up to work drunk. If they do, they'll lose their jobs. So the same thing is probably going to happen when it's cannabis.
I do think the stigma will stick around for a little while, but I do also think that through education and through time, it'll go away.
I just have a question. Is there a way to determine whether someone is high? And like, there's a breathalyzer test for police for drunk driving. If you're stopped and you're driving and you're suspected to be high, how do you prove it? I don't know.
Impairment is proven by performance. For example, impairment is proven by performance. When we're talking about driving on the road and whether people are driving while they're high, it doesn't matter if it's from the sleeping medication they took or the French fries they just spilled on the floor. If they're driving dangerously, a police officer can tell and other drivers can tell. That's performance. But when you're talking about a substance, there are people who are going to smoke and get behind the wheel and you won't notice. Right now when you're driving, I guarantee there are people driving around you who have smoked recently. But impairment is proven by performance. If you see...
you can't prosecute that. I mean, that's what
you used to get sobriety tests at the side of the road, and they'll have to go back.
Well, that's what I'm asking.
They still do sobriety tests at the side of the road, just to let you know. The touch your nose, walk a straight line. Those sobriety tests are still used by the police, and I'm sure they can still determine if someone's impaired.
And are used to secure convictions?
A lot of people have been convicted for driving with impaired, I'm sure. I'm not a lawyer, I'm not a Crown prosecutor.
I don't know how long I don't know exactly what the punishment is, but I have been told by a police officer that if he does catch somebody, you know...
See, at this point, people are convicted of driving under the influence of marijuana only by having it in their system, not by the fact that they were impaired.
Sorry, I'm going to go to this gentleman here in the black t-shirt because he's been waiting for a bit.
Right, actually, I was going to speak to the same point that Greg was there, that actually in some places, like in Washington State, for example, as part of their legalization efforts there, they did pass a nanogram limit in terms of blood that can be used to prosecute people. Now, they still have to be judged to be impaired by a police officer before they can be pulled over for that. And what I would suggest is, if we did something like this in Canada, we should stay away from those nanogram limits in terms of blood content, because they don't mean anything and they're unscientific completely. And actually, even the people who worked on the campaign to legalize there, they actually admitted that it wasn't scientific, but they were doing it in terms of the politics of it. But I think we should stay away from it because in Washington State, for example, there was a big, huge no campaign from the marijuana legalization community because of just that nanogram limit, essentially.
Yeah.
So, I just want to point out in relation to this concern, one of the items that came up on one of the slides here was research into impairment.
Yes.
So that is absolutely why.
That's about the only mention of this topic in the paper, actually.
But all this is the reason why we need it.
Yeah.
You definitely researching impairment.
I mean, the illegality of it impairs the ability to research at this point, right?
That's
Well,
right.
I do have something to add to that. The Liberal Party of Canada loves to base our policies on evidence, okay? And that's why the research clause is in there. We will research it, and we will make our policies based on the evidence that's presented.
I put the gentleman in a gray. I just want to point out that is a very important thing we have there. And this discussion shows why it's so necessary. But one other thing I want to mention, which most people don't know, we learned this from another elite member who was an air traffic controller. Because air traffic controller, you can imagine, performance is a big issue. If you screw up your performance, nasty things happen. They did a lot of research on what impairs air traffic controllers. What do you think impaired air traffic controllers more than alcohol, marijuana, or hard drugs?
Lack of sleep.
Lack of sleep. Lack of sleep was worse for their performance than anything else they could put them under.
Interesting. Gray suit, this lady, then this gentleman here.
I did actually critique the impairment side of the document, and it does say in there harsh penalties for impairment. Alcohol is a fermenting of berries and fruits that results in a poison that dulls your senses. Cannabis is not that. It is in conjunction with your endocannabinoid system. It helps to enhance your senses and helps you appreciate things in its proper dose. It can impair. It can impair novice users. It can impair veteran users over above their normal dose regimen. But for the most part, it needs to be understood when you're talking about impairment with motor vehicles that cannabis does not automatically impair its users. In fact, in most cases, veteran users within their normal dose parameters are not impaired. If anything, they are enhanced. And the studies that have written back that up and said cannabis users are more cautious drivers, they're more aware drivers. So that, I hope evidence-based will eventually result in that. But at this point, the document does read harsher penalties for and blah, blah, blah. Which, impairment should be dealt with harshly for sure. It's up to an individual to know when they're impaired, but testing for what's in a person's system, in my opinion, the opinion of other experts, does not determine impairment with respect to cannabis. Cannabis stays within a person's system for a long time. Chronic users can have it within their system for over 30 days, and they're certainly not impaired if it was cannabis that impaired you for 30 days. Boy, that'd be really expensive. That's not another thing with the question of age of accessibility. When the Senate looked into this 10 years ago, they concluded 16 would be a good age for access, and also no penalties for youth, just penalties for retailers by youth that are not their parents and family. So, thanks.
This lady here.
My question is, nothing calls me from prison. I missed the beginning of your presentation, but what I did see, this is fantastic. It's the questions everybody is asking. So is this something that a Liberal member of Parliament is going to present as some sort of legislation based on that, or what?
Can we just defer that just to the last part, because it's kind of an ongoing thing, or, it's
I think to show that with everybody,
yeah,
the media,
absolutely.
everyone wants that sort of document.
Well, it is on our website now at bc.liberal.ca. We unveiled it over the weekend, and it has become public. I can definitely give you guys the website afterwards if you can catch that. No, we do need to get into government first.
Yeah.
We have many people who are supporting this policy, including MPs and leaders. We are working on a few of our MPs, though. Not everybody has gotten behind it just yet, but this is why we're creating the paper, is to get them on side first.
And just to make it clear, there is no leadership candidate opposed to this policy. So each and every leadership candidate is for this policy, just to let you know.
Well, some of them are quite mealy-mouthed about it.
Yeah.
That I've
Okay, we're not doing the leadership thing here. The gentleman at the hat.
This is a sort of a white elephant in the room, and it regards to other drugs. And because at one point, marijuana was one of those other drugs. Putting aside the age and impairment of motor vehicles, where the heck does the government get off telling me what I could put into my body, be it marijuana or cocaine or heroin or anything that may or may not harm me, but may not harm me for responsible use. And when you say in this, you're not going to touch other drugs, I can kind of understand that, but I'd like to hear your explanation.
My explanation would be...
I've got an explanation to that.
And so do I, so
Yeah.
I'll let you go first.
It's a public health issue when you're using the other drugs, the addictions. I mean, I'm the president of the Vancouver East Liberals, okay? We've got the downtown east side in my riding. A lot of those people are drug addicted. They're addicted to heroin, they're or addicted to cocaine,
Are
or
you saying that
addicted to
every
both,
single person
or
that
addicted
takes
to a lot,
these drugs becomes addicted?
Oxycontin, okay?
And they're not criminals.
They're not, no one is, I agree that there is a problem with the way we're fighting the war on drugs. I do believe that there is, the enforcement is not working, okay? But
Prohibition exacerbates all of the drug abuse issues.
We'll get to it, Phil, we'll get to
We'll get
it.
to
We
it.
never went to marijuana.
Yeah, my answer is,
Small steps, one thing at a time, we get rid of it.
but those other drugs
it's a hard
have
question.
killed
I know.
people. You know, cannabis has not killed a person, where
It's true.
heroin and cocaine and all these other drugs have killed.
my answer is a little more cynical. Politics is the art of the possible. Like, how long have you been more in this? I have people come up to me at convention saying, we started this like 30, 40 years ago, and here we are still doing it. So maybe at this point this is possible. That's kind of where I go. There was one other question, but you had a question.
Yeah, my question's about sort of creating this culture in Canada, or Canada being like a destination for people to come to smoke marijuana. And I haven't read this fully yet, but I don't know if you touch on it. But is there any concern at all that Canada is going to be sort of like a destination for potheads around the world? And I use that term sort of. I hope so.
Tourism, right?
There are positive and negative effects of that. And
I personally
Holland, for example, is backing away from some
No,
of
they
that.
changed that actually. Now they're
That
allowed
was just a
to.
conservative government that was trying to back away from them, but the people of Holland decided that they wanted.
They're like, no,
I've
let
been
the
to
tourists buy
Holland.
pot. They decided not to ban tourists from buying pot because it would be devastating for their
Do
economy.
the Dutch people buy
The
pot?
Dutch
Yes,
people
they do,
yeah.
yeah.
They like their system. It works for them. And
So I would say-
But I think it's a legitimate concern that some Canadians who don't smoke weed and have no appreciation for it might think, hey, I don't want my country to become a destination for marijuana users.
But why not?
And I think two more questions here, and then we're going to do this informally, because I have
It
no
is
more.
something that, right now, something to look into.
Quick question?
Yeah, with respect to that, I mean, Canada's that'd be good for our tourism industry for sure. But there's something in the document that speaks to whether or not the government can be found to be derelict in their duties with respect to not controlling a substance that is so widely used and does have a health impact. And that can certainly, I mean, I don't even want to talk about only marijuana here, but that certainly extrapolates to the other drugs as well. They're really derelict in their duties because all we can do as a society is try and protect people as best we can from the substances that are causing problems through regulations, restrictions, and taxation. But whenever those get to the point that the black market takes over, you have to scale them back. That's got to be the mandate of the regulators because the black market operates without any regulations. They'll sell anything of any quality to anybody of any age. You have no control whatsoever. All we can do as a society is put the controls on that we can. You're still going to have drug abuse issues for sure. That's still going to plague us. Drug addiction, all of those things are going to be part of our society. It's how we deal with it. And the way we've been dealing it with the drug prohibition, as I mentioned before, it exacerbates all of these drug abuse issues and allows unregulated access to people with no controls, no information, no education at all.
Last question to the man in the black t-shirt.
Yeah, so I was curious how you would go about preventing, or whether prevention of such thing would be desirable, of keeping a company that, such as Monsanto, for example, that takes plants and modifies their genome so that they destroy farmers' livelihoods and spread and prevent plants from, that aren't genetically engineered from them reproducing and being able to be used again. How would you prevent Monsanto from coming in and taking over that market?
I'll take that question. Let's look at wine, okay, guys? When you buy Merlot, is the Merlot itself protected? Is it copyrighted? Merlot grapes are not copyrighted. So, they genetically modifying things happen in the vineyards. They do happen, but you can't, it's going to be difficult for companies to, I'm sure a liberal government will make it difficult for a company to basically put protection rights on strains and whatnot. And I mean, cannabis producers genetically modified weed right now, cannabis right now. So this is something that goes on. We're not going to let people say, hey, this strain is ours. sit, because it just sounds silly. It's like, if we want to treat it like wine, which seems to be the consensus, we shouldn't go, my answer is no, it's not going to happen.
People won't buy it. They'll buy the organic stuff.
Yeah.
If there's still choice, people will say, I'm not choosing GMO, I'm choosing the organic local.
Okay, guys, that was my parking going off. So for that very important reason, I'm gonna do the last slide here, and then you guys are free to discuss this informally for as long as you like. And I just wanted to address where this is at. This is a resolution that has been passed, and then this work here by the working committee has built on that resolution to give it some bones. We are now shopping that around to you guys. We did it at the convention, so a big schwack of the party saw it. We're going to be making sure that it's in the hands of all of the leaders. And basically we're going to vet it as widely as we can so that there is that big discussion. But obviously it has to, and then the other part of it is to make sure that it ends up as part of the election platform. And then hopefully, if the Liberals...
What are the chances of that?
Sorry?
What are the chances of that?
It's the election platform? I can't really call it. I would say by the response.
I was going to say, when it comes to the election platform, the person who has a big impact on that would be the leader of the party. And like Mark said, all leadership candidates are supporting the legalization of marijuana. If you do want to help with this, we do highly recommend that you sign up as a supporter. It's completely free to do. Pick and choose which leader you support, and
does everybody know how to become a supporter of the
I'll tell you.
Yeah.
It's free and you do it on the web, okay?
Very easy, liberal.ca.
And they're making their tours around the country. You definitely talk to each and every one of them and say, will you actually do this? Will it be on the platform? It's an important question that they all should answer for sure.
What about the current regs in the House right now? They're putting this through, right? And it's going to stop the current program of medical marijuana. And it's going to give it all.
They have a majority government. At this point, they can do it.
Yeah, Stephen Harper doesn't care about this issue. Yeah, if you've noticed his conduct over the last, since he's been Prime Minister, but since he's had this majority government, all he's done is try to shove these omnibus bills down our throats, leaving no room for due process, discussion. He's actually assaulted democracy. He's raped it. And
so guys, I'm going to, because of my parking, dissolve the formal session here, and you guys are free to slag Mr. Harper as much as you like. Thank you very much, everyone.